what's called an indication. And that is, again, I'll share this with you. I'm sure this is going to come as a shock to everyone. Insurance companies are not interested in losing money on you. So whatever the premiums they were charging you, we're pretty confident that there's some profit in that. And so we can reverse engineer your current plan based on your plan design and census and come up with a pretty accurate, we believe, representation of where your money's going. And then the opportunity that could be found within that. And that's if you're over 50 employees, or if you are on a level funded plan, or on an experience rated platform. The pre-authorization process, or the process that an employee would go through to determine pricing and structure and opportunity and all of that. And this is really where I'm excited about the relationship with Mary Lanning, because this is where the insurance plan and you, the employer, and the hospital system, because this is your plan, are in alignment versus what oftentimes we find now, which is they're in conflict. And so the partnership that we have with Consociate is to manage that predetermination, pre-authorization process in conjunction with both the employee, the plan document as we structure it for you on what you want the plan to look like and do, and then the hospital system. And we've got a direct line of communication with the physicians organization, with the leadership, with the administration, and so that there is a very much an understanding of this is absolutely medically necessary. This is the best course of treatment. And that's one of the things that I was really excited about, and I said at the very beginning, and even Eric touched on it, is that for healthcare to be sustainable, or we can get ahead of where the healthcare system has been going in the United States, it's to have a better understanding of the care that we need when we need it, and are there other alternatives or avenues to care.
You know, part of what we wanted to build into this plan is a little bit of flexibility, but we wanted to make it more user friendly, if that's a thing, because insurance companies have a habit of putting up as many obstacles as they can between the patient and the providers. Pre-authorization processes are just so onerous, and pre-certifications that might actually be a pre-certification until the claim has been filed. They're like, oh no, that didn't really count, so they deny the claim. And so we've tried to eliminate as many of those barriers as we can, and again, see this as a collaboration and trying to help you as the employer and your employees as the patients access the care they need when they need it based on their physician's medical judgment.
When we've done this in the past, we look across the country in working with Consociate is where they've had the most success. It is when we can reduce that deductible to $0. And I will tell you, and I know this is counter to what likely you have been told for years, right? The insurance industry has fed the lie that raising deductibles is the solution here. That is misdirection. It's not the solution. Remember, 90% of cost, 10% of the population. The vast majority of plans that we review have limited deductible utilization anyway. And so from an employment perspective, from a attraction and retention perspective, the higher the deductible, likely the worse it is and harder it is for you to attract and retain. The lower the deductible, the easier. And what Eric has said and what I will say and what Consociate would tell you, and pretty much any independent mind that has looked at healthcare, and I've been in the business for 20 years, the employers with the lowest deductibles have the lowest cost experience. And that's because their people are getting access to the care they need when they need it. And so if we have contracts in various other areas, we're going to utilize those contracts for you. So have a conversation with us so that we can take a look and see. But the idea here is that things don't get worse. They can only get better. And they can get better, not just in Hastings and the surrounding area, but throughout Nebraska and beyond.